Hey everyone, welcome back to Freedom Flicker. Today we're diving into a massive story shaking up the world of public health. Susan Monarez, the director of the Centers for Disease Control and Prevention, has been ousted just weeks after her Senate confirmation, making her the shortest-serving CDC director in history. And that's not all. Several top CDC officials are also out, reportedly over clashes with Health and Human Services Secretary Robert F. Kennedy Jr. about COVID-19 vaccine policies. What's going on here? Was Monarez really fired for pushing vaccines, as some reports claim? And what does this mean for the CDC, public trust, and the future of vaccines in America? In this video, we're going to break it all down. Who Susan Monarez is, why she was ousted, the role of RFK Jr.'s controversial vaccine policies, and what this chaos at the CDC could mean for you. Stick around for deep analysis, and don't forget to like, subscribe, and hit that bell so you don't miss our next deep dive. Let's get started. First, let's talk about who Susan Monarez is and how she ended up leading the CDC. Monarez, a microbiologist and immunologist with over 20 years of government experience, was confirmed by the Senate on July 29, 2025, as the CDC's 21st director. She was the first director to require Senate confirmation under a new 2023 law and the first non-physician to lead the agency in over 70 years. That's a big deal. This is a woman with a PhD in microbiology, not an MD, which sparked some debate about her qualifications. Before the CDC, Monarez served as deputy director at the Advanced Research Projects Agency for Health, or ARPH, and worked in biomedical research for the Department of Homeland Security. She briefly served as the CDC's acting director from January to March 2025, stepping down when President Trump nominated her after withdrawing his first pick, Dr. David Weldon, a vaccine skeptic. During her Senate confirmation hearing on June 25th, Monarez walked a tightrope. She emphasized her belief in vaccines, saying, quote, "Vaccines absolutely save lives," and supported fluoridated water as safe, which put her at odds with some of RFK Jr.'s views. But she avoided directly criticizing her boss, Health Secretary Robert F. Kennedy Jr., even when pressed by Democratic senators like Maggie Hassan and Tim Kaine. They wanted to know if she'd stand up to Kennedy's vaccine skepticism. Her response? She'd be an independent thinker and provide science-based advice. Monarez took office on July 31st. But her tenure was anything but smooth. Just one week in, on August 8th, a tragic shooting at the CDC's Atlanta headquarters left a police officer dead. The shooter, a 30-year-old man, reportedly blamed the COVID-19 vaccine for his mental health struggles. This incident shook the agency, already reeling from staff cuts and low morale. Monarez tried to reassure staff, but the pressure was mounting. So, who is Susan Monarez? A scientist with a strong public health background. Now, let's get to the heart of the story. Why was Susan Monarez fired after less than a month? The official statement from the Department of Health and Human Services was vague. On August 27, 2025, they posted on X, quote, "Susan Monarez is no longer director of the Centers for Disease Control and Prevention. We thank her for her dedicated service." No clear reason given. But multiple reports, starting with the Washington Post, suggest Monarez was pushed out over disagreements with RFK Jr. about vaccine policy. Here's what we know. Robert F. Kennedy Jr., a longtime vaccine skeptic, was appointed Health and Human Services Secretary by President Trump. Kennedy has a history of questioning vaccine safety, including pushing debunked claims about vaccines causing autism. Since taking office, he's made big moves at the CDC. In June, he fired all 17 members of the CDC's Advisory Committee on Immunization Practices, or ACIP, claiming they had conflicts of interest with Big Pharma. He replaced them with his own picks, including some vaccine skeptics. Then, in May, he bypassed ACIP to end federal recommendations for COVID-19 vaccines for healthy children and pregnant women. Monarez, during her confirmation, stressed that vaccines save lives and promised to prioritize their availability. But reports suggest she objected to Kennedy's overhaul of vaccine policies, particularly his push to rescind or limit COVID-19 vaccine approvals. The New York Times reported that Monarez clashed with Kennedy's team, including his Chief of Staff Matt Buckham and the CDC's Chief of Staff Matt Bazzelli, over these changes. Her refusal to fully align with Kennedy's agenda may have sealed her fate. On the same day Monarez was ousted, Kennedy announced that the FDA had revoked emergency use authorizations for COVID-19 vaccines, replacing them with narrower approvals that limit access for some groups. This timing raises questions. Was Monarez fired for trying to preserve broader vaccine access? The ousting of Susan Monarez wasn't an isolated event. On the same day, at least 4 other top CDC officials resigned, including Jennifer Layden, a key figure in data and surveillance. This mass exodus has left the CDC leaderless again, at a time when it's already struggling. Let's break down what's happening at the agency and what it means for public health. First, the CDC has been hit hard since the start of Trump's second term. Reports say the agency lost about 1/3 of its staff due to layoffs and funding cuts. Kennedy has also moved to refocus the CDC solely on infectious diseases, planning to transfer chronic disease programs to a new entity called the Administration for a Healthy America. This has demoralized staff, with one CDC employee telling NPR, quote, "Morale is very low." Then there was the August 8th shooting at the CDC's Atlanta headquarters. The shooter, Patrick Joseph White, fired over 180 shots, blaming the COVID-19 vaccine for his depression and suicidal thoughts. No CDC staff were injured, but the incident deepened the agency's sense of crisis. Monarez held an all-hands meeting the next day, where employees called out Kennedy's vaccine misinformation for putting a target on the backs of public health workers. The resignations of top officials add fuel to the fire. Public health experts like Dr. George Benjamin from the American Public Health Association are worried that Kennedy's actions, firing ACIP members, limiting vaccine approvals, and now ousting Monarez, could weaken the CDC's ability to respond to health threats. For example, the U.S. is seeing the highest measles cases in decades, and Kennedy's mixed messages on measles vaccines aren't helping. Praise Kennedy for questioning mRNA vaccine safety and canceling nearly $500 million in contracts. Others, like J. Reiner, MD, call his actions malevolent, accusing him of undermining trust in vaccines. The truth likely lies in a messy middle. Kennedy's skepticism may resonate with some. So, what's next for the CDC and vaccines in America? With Monarez gone and no permanent director, the agency is back to square one. Kennedy, as HHS Secretary, seems to have a firm grip on vaccine policy. He's already announced that the new ACIP is reviewing the cumulative effects of childhood vaccine ingredients and COVID-19 vaccine safety. Their next meeting is coming up, and it could lead to more changes and recommendations. Kennedy's Make America Healthy Again agenda, as he calls it, focuses on reducing pharmaceutical influence and promoting alternative health approaches. Some ex-posts, like one from Eric L. Daw, claim Monarez was chosen for aligning with these values, but her ousting suggests she didn't align enough, or maybe she pushed back too hard. Either way, Kennedy's influence is reshaping the CDC, and not everyone's happy about it. Public health experts warn that further cuts to vaccine programs could lead to outbreaks of preventable diseases. Measles is already a growing threat, and if trust in vaccines erodes further, we could see worse. On the flip side, Kennedy's supporters argue he's exposing flaws in a system too cozy with Big Pharma. The big question is, who will lead the CDC next? Will they be another Kennedy ally, or someone who can bridge the divide between science and politics? And how will this affect your access to vaccines or trust in public health? Drop your thoughts in the comments. I want to hear what you think about RFK Jr.'s moves and what you'd do if you were running the CDC. That's the story of Susan Monarez's ousting and the CDC's latest crisis. To recap, Monarez, a scientist with a strong public health record, was fired after less than a month, reportedly for clashing with RFK Jr. over vaccine policy. Several top officials resigned, leaving the CDC in turmoil amid layoffs, a shooting, and controversial changes to vaccine approvals. Whether you think Kennedy's shaking things up for the better or risking public health, one thing's clear. The CDC's future is uncertain. What do you think? Should the CDC stick to science? Or is Kennedy right to question the system? Leave your comments below, and let's keep this conversation going. If you found this video helpful, give it a thumbs up, share it with a friend, and subscribe for more deep dives into stories like this. Next week, we'll be looking at TEAS-related topic, e.g., the future of mRNA vaccines, or another health policy shakeup. Thanks for watching, and I'll see you in the next one.